Hi, everyone. This is Janet Hill at the Rock Island County Health Department. Thank you for joining us. It's 3:30 p.m. on December 8th. Today, we have with us Nita Ludwig, the administrator of the Rock Island County Health Department, and Edward Rivers, the director of the Scott County Health Department. They will be speaking about the intensive vaccine planning process that both health departments and various other partners throughout the community are working on. But first of all, let's start with Rock Island County numbers, Nita.
Good afternoon. Unfortunately, today we are reporting 3 additional deaths from COVID-19 in Rock Island County. A man in his 90s, a woman in her 80s, and a woman in her 70s, all of whom have been in long-term care facilities. Again, we express our deepest condolences to the family and loved ones of these individuals. In addition, we also have 94 new cases of COVID-19 in Rock Island County, which brings our total now to 9,293. There are currently 83 people hospitalized in Rock Island County with COVID-19.
In Scott County, the number of cases today is 12,305. Our deaths are reported as 104. It should be noted that this total is greater by 4 due to the state's change in its procedure and how it counts COVID deaths.
Thank you. So today, as Janet mentioned, we will be talking about COVID-19 vaccination planning, and we have set up a question and answer format for you to be able to share some of this information. So we're going to go ahead and get started. Ed, can you answer these first couple of questions? Who is involved in the vaccination planning in the Quad Cities?
Well, our health departments, emergency management agencies, our local health systems, Genesis and Unity Point, and community health care, the federally qualified health center. We meet frequently and are updating our plans as new information is released from the CDC and the state health departments.
Can you please describe what do these plans include for vaccinations in the community?
Well, it includes education on the vaccine, how we'll store vaccine, where it will be given, and how we'll communicate to individuals when it's their turn to get the vaccine. Giving vaccine during a public health pandemic where social distancing is so important for planning for the general public. However, our plans are addressing these important factors too.
Should the public expect that the vaccination distribution will be similar between Iowa and Illinois?
Unfortunately, probably not. Similar to the beginning of the pandemic, we're planning for the rollout of vaccine distribution to be different between the two counties due to the fact that they're guided by 2 different states. We know this is going to be frustrating and can add another layer of challenges, not only to our planning and our communication with the community, but it's also frustrating when the rollouts are different. We realize we're going to need to be flexible and make changes to our plans as new information and guidance is given to each of our counties. So we ask that you be patient with us.
Who's making the decision for which groups get the vaccine when?
There's a federal advisory group called the Advisory Committee on Immunization Practices. This group's announced their recommendations for the first phase of COVID-19 vaccination. The committee recommended the vaccine should first be offered to healthcare personnel and residents of long-term care facilities. In Iowa, an infectious disease advisory committee has been created to provide further guidance on the order in which individuals in this first phase, phase 1 being first C, will be vaccinated. The Illinois Department of Public Health is also working on its phased approach. It's adopting the National Academies of Science, Engineering, and Medicine's framework for equitable allocation of COVID-19 vaccine.
So as you mentioned, the groups that will get vaccine first, why will healthcare workers and residents of long-term care facilities get those first doses of the vaccine?
As the discussions took place at the federal level, the factors that played a role in the priority involve decrease death and serious disease as much as possible, preserve the functioning of society, and reduce the extra burden the disease is having on people already facing disparities, and increase the chance for everyone to enjoy health and well-being. Healthcare workers in particular, and those in hospital settings, are at the front of the line to get the vaccine because of their exposure to patients and their vital presence to keep the healthcare system running. As more vaccine becomes available, more healthcare workers will receive the vaccine. Residents in long-term care facilities have accounted for a large proportion of hospitalizations and deaths, which indicates that these individuals have been bearing a greater burden of the negative outcomes from COVID-19. These factors contributed to the committee's recommendation to prevent spread by protecting those on the front lines, healthcare workers treating COVID-19 patients. Once these groups have been vaccinated, the next group in the priority list will begin to receive the vaccine.
Thanks, Ed. Now let's pull Nita in for some of these questions as well. Nita, can you explain how will individuals in the community know when it's their turn to get the vaccine?
Sure. So we do have a team in place working hard to communicate this important information to our community. You can expect to get information on this from our departments through all of our avenues, such as social media, our website, and our local media partners, and also our healthcare providers.
Another group in the community, when will businesses and workers get access to the vaccine?
While we can't give an exact timeline, we do know that the National Proposed Priority Group recommendations have essential workers listed in Phase 1B, and this means they would be next in line after the healthcare workers and the long-term care staff and residents. We expect guidance to come out soon to tell us exactly who those essential workers are going to be in what order.
For businesses in the community, what should they be doing right now to prepare for the vaccine that is to come?
So we encourage all businesses to learn more about COVID-19 vaccine and to help begin the first phases of planning vaccination for your employees. The CDC has frequently asked questions about the vaccine, and that can be very helpful. Employers can also begin making sure that they keep updated on the roster of employees and businesses that meet those definitions of essential or critical infrastructure workers, while others may get vaccinated at a later date. We promise to share information regarding the groups getting vaccinated as soon as we can.
When will a business know that it's their turn to get the vaccine for their employees?
As we move through the Phase 1A vaccinations for our healthcare workers and our long-term care residents, we will begin more detailed planning for Phase 1B. This planning will include communicating new information and timelines to businesses with essential workers in our community. We also ask that you be patient with us again as we wait for this to roll out and new guidance to be shared. We know it's difficult not to have all the answers at this time, and we also know that the vaccine production will increase as the weeks go on.
Just for any individual in our community, where should they look to learn more information about vaccines?
Sure. First, it's important to use reliable sources of information when learning about COVID-19 vaccine. And this type of information is researched, written, approved, and peer-reviewed by subject matter experts. Locally, reliable information is available from Scott and Rock Island County Health Department websites. The QC COVID-19 Coalition also has a website called togetherqc.com. This site has a very similar information on the vaccine from our CDC and our state health partners. Your healthcare provider will also be a good source of information on the vaccine when it comes closer to your turn to receive it.
So Nita, we'll give you a chance. What main message would you like to share with the community about the role each person plays in our vaccination plans?
Sure. While our plans are vast and involve lots of factors, we are planning how we will make vaccine available to everyone in our community. When your turn comes, please consider getting the COVID-19 vaccine. The more individuals that are vaccinated in our community, the greater likelihood we will have of slowing down the virus. The vaccine, along with wearing a mask, social distancing, washing your hands, and staying home when you're sick will be very important tools as we help to slow the spread of this virus.
Thank you, Ed and Nita, and we're very grateful for all the partners that we have who are helping us with this vaccine planning and eventual distribution. So now we'll take any questions that our media partners have who are on the call. We'll give it a minute or two here. As always, we are recording this and we'll be posting it on our website along with our social media pages, and a typed out question and answer responses will be sent in our follow-up press release. Okay, looks like a couple questions here. Off vaccine topic, what are the total numbers from testing at the Tax Slayer Center over the weekend? Do you happen to have an idea there, Nita?
Sure, I do know. So on Saturday, December 5th, they did 517 tests, which is a record. So that's well over what we have done in any given day when we've had the testing site here before. So that was great. On Sunday, they did have a logistical issue at the beginning, so they were a little bit delayed in starting the testing on Sunday. However, they still did over 380 tests, which was still higher than any one day previously. So overall, they did a great job. And they will be back again on December 15th and 16th at the Tax Slayer Center.
And maybe you can respond to this question. Positive case numbers are down in both counties. Is this the start of a trend, or what do you make of this? You know, start with that one, Ed.
I certainly hope it's a trend. And as for what I make of it, I also certainly hope that communities listen to our advice about not gathering for holiday gatherings, or being extremely careful and doing it only within your households if you do. This is an outcome that we would have hoped for, and I hope it continues.
I'm going to the Pfizer vaccine. It requires 2 shots, which is correct. How will they, how many will not get a second shot, and will they be protected or not? Ed, do you have any information on that? I know there's a little bit new that came out about what the first dose and some protection that comes from that.
I'm not sure I understand the question. The Pfizer vaccine, both of them actually, Pfizer and Moderna, require 2 doses, and a person has to receive both doses to have optimal protection. I can't think of a reason why a person would not receive 2 doses. That's already allowed for in the system.
And do you know if the planning team is discussing possibly working with individuals to get scheduled for those second doses while they're receiving their first doses?
That will be part of the logistics. When people are assigned an appointment, then that follow-up date, either 21 days or 28 days in the future, would be settled before they leave after the first vaccination.
Nita, last question for you here. What did those record testing numbers say to you? And has there been any progress on getting a permanent testing site in Illinois?
Sure. Well, those numbers just tell me that there are a lot of people out in our community who feel like they need to be tested for whatever reason. We do know that there are still high numbers in our community and a high positivity rate. So I'm glad that people are taking advantage of the testing when it's here and it's available to them. And I'm sorry, Brooke, I forgot the second part of that question.
Any news on a permanent site?
Oh, sure. So I have asked that of the state several times. They have said that they would like to make a longer site available to us here in Rock Island County, but they haven't gotten back to me with any proposed dates. So when I'm able to, I request the site come here at every open time slot in their schedule. So that's why we do have them coming back December 15th and 16th. And then again, the weekend after Christmas, which is December 26th and 27th. They're all dates at the Tax Slayer Center this time, 8 a.m. to 4 p.m.
One additional question, may have missed this, but when do both counties expect vaccines to begin arriving? Nita, do you have just some general information about that?
Sure, we've been having many state calls, webinars, Zoom meetings, all of those sorts of things. And we are asked to prepare for a possible vaccine to come to us within the next week or week and a half.
Ed, is that the same for Scott County?
State of Iowa has been told to expect its first allocation on or about the 13th, and the counties would be receiving it after that date.
Okay. Don't see any additional questions at this time. We do look to provide some information on just general COVID-19 vaccine 101 at the upcoming briefing later this week. So please be prepared for some of that information. But in the meantime, we will get this posted, and we appreciate your support in getting this information shared with the community. Thanks everybody for joining us today. Have a great afternoon.